In the United States, more than 1.1 million people could die over the next decade. No, it is not about heat waves or droughts. This time, people are dying because of overly expensive medications. This isn't some future problem. It's already happening now. Every day, families are ripped apart by impossible choices. Keep the lights on, put food on the table, or pay for the medicine that keeps them alive. What would you do if survival meant drowning in debt? This is a reality for millions of people today. Behind closed doors, deals are made and decisions are taken that most of us will never hear about. But the effects? They are felt by all. Big Pharma's secretive pricing strategies are not just costing money, they are costing lives. But who is pulling the strings that make life-saving medicine so out of reach? And why does it feel like no one is stopping them? Are drug companies making us pay the price for their profits? Or is there something even darker happening? In this video, we will uncover it all. Let's dive in. There is no doubt about the fact that healthcare is super expensive in various parts of the world. But the numbers behind drug pricing are sure to make your blood boil. Let's start with insulin. It's a medicine that millions of people with diabetes need to stay alive. In the US, a vial of insulin can cost $300, while in Canada, it costs you $35. Same medicine, same companies. But why such a massive difference in the prices? Well, now let's address a disease that is enough to send shivers down the spine. We are talking about cancer and its expensive medicines. Take Revlimid for example. One pill costs $937 in the US. Yes, you read that right. $937 for a single pill. Now, imagine needing this for every day for months. Most people can't even think about affording that, and those who try, they end up drowning in debt. This isn't just about numbers, it's about real people and their lives. People who are skipping their medicines, cutting pills in half, or straight up choosing debt over debt. Can you imagine being in that condition? Think about diabetic patients. 1 in 4 Americans with diabetes limits their insulin intake because they can't afford it. Do you think that's just inconvenient? No, it's deadly. People are ending up in hospitals. People are dying, but for what? So pharmaceutical companies can keep their profits high and reward their CEOs with million-dollar bonuses? What about families battling cancer? Parents are forced to sell their homes, drain their savings, or crowdfund online just to afford a few months of extra time with their kids. It's heartbreaking, it's wrong, and the worst part, the people in power know this is happening. But how did we get here? How is Big Pharma setting up their prices so high? It's a story full of twists that will shake you up completely. It's not limited to only high drug prices. It's also about the sneaky system that is designed to keep profits high no matter what happens to the suffering patients. Here's the scoop. Companies get patents on new drugs, which gives them the right to be the only sellers for up to 20 years. However, when these patents are close to expiring, these companies make tiny changes to the drugs and get new patents. This trick is known as evergreening. Evergreening stops cheaper versions of drugs from hitting the market and keeps prices high at all times. For example, insulin has been around for over a century and is a lifesaver for over 8 million Americans. Yet, the price for one vial has jumped dramatically in some places. A Lancet paper that talked about the insulin price increase in 2027 mentioned, older insulins have been successfully replaced with newer, incrementally improved products covered by numerous additional patents. More than 90% of privately insured patients with type 2 diabetes in America are prescribed the latest and costliest versions of insulin. Even though companies like Eli Lilly say they are cutting prices, the big picture hasn't changed much. The system that lets prices keep going up is still in place, and it's not really helping the patients who are struggling to pay for their meds. Then there are the middlemen called pharmacy benefit managers or PBMs. PBMs are supposed to help lower prices for patients, but instead, they are doing the opposite. They are actually keeping prices high by making deals based on the inflated prices. While Big Pharma games the system, governments often look the other way, or worse, they allow it by not restricting them. Unlike other countries, the US imposes no caps on drug prices, leaving companies free to charge whatever they want. In fact, pharmaceutical companies spend billions lobbying against price control laws, ensuring the system always stays in their favor. The pharmaceutical industry's grip on drug prices doesn't end with patents and government loopholes. As if exploiting the system through evergreening and lobbying wasn't enough, Big Pharma's web control extends far beyond the public eye. The true scandal lies in the secret deals and shady practices. They make secret deals to keep cheaper drugs out of insurance plans. This whole setup works perfectly for the companies seeking profits, but not for the people who really need the medicine. But what is their defense? How do these companies justify the prices? Big Pharma often says they set high prices so that they can fund research and development. But here's the shocking fact. They spend a lot more on marketing than on developing new drugs. In 2020, AbbVie, which manufactures branded drugs like Humira, spent $11 billion on sales and marketing alone. Meanwhile, for R&D, they use only $8 billion out of their pockets. It seems they care more about making money than about making medicines that saves lives. Now think about this. In Germany, insulin can cost as little as $5 a month. In the UK, it's often free. So, it's pretty clear where the priorities lie. It's all about the money for the US, not saving lives. Even when cheaper versions of insulins are available, they don't get much attention because of all these pricing games. This lack of competition is no accident. It's all part of the plan to keep certain companies in control. Some new efforts are trying to change this by offering insulin at fair prices with these middlemen. While this is great, it's only a small fix to a big problem. The whole system needs a major change to stop these profit-first practices that hurt patients. How many more people have to suffer high prices before real changes are made? We need a system that cares more about people than profits. But who's benefiting from all of this? We are living in a world where the rich keep getting richer and the sick get sicker. Sounds like a scandal? Well, welcome to the world created by the pharmaceutical industry. Ever wondered who's really pocketing the cash when you are stuck paying sky-high prices for your meds? The truth is way darker than you might think. Behind those inflated drug prices is a game of power and profit. And let's just say the winnings aren't being shared fairly. At the top of the chain are the CEOs and major shareholders of the pharmaceutical giants. They are earning billions from stock options and dividends. In 2020, while the rest of the world was struggling to stay alive, one Big Pharma CEO pulled in a salary worth of $14 million. Meanwhile, do you remember what issues regular families were facing at the time? They were rationing groceries, skipping bills, and desperately trying to afford life-saving medications. It feels like these executives are living in an entirely different universe. But hold on, this whole problem goes far beyond the US borders. How is the world holding up with all of this? What about the poor countries? Well, it's a global issue, and poorer countries are hit the hardest. With fewer rules and less power to negotiate, these countries pay huge prices for the same medicines that cost a lot less in richer nations. This kind of pricing is really costing lives. The World Health Organization has even criticized the system, saying it prevents people in poorer countries from getting the medicines they needed. They also said that it creates huge health gaps around the world. So, while Big Pharma is filling up its pockets, the rest of the world is left in the dust. Middle-income families are paying the price for an unfair system that's getting harder to ignore. The actual cost of unaffordable healthcare is unbearable, and it's hitting people hard. There are various stories coming to light these days. Stories that talk about thousands of families who can't afford the medications. Think about the mother who has to choose between paying for her child's medicine or feeding her family. Think of a father who watches his child's health getting worse, but yet he is unable to do anything because the treatment is so expensive. For many, untreated conditions are no less than death sentences. People with treatable illnesses like diabetes or heart disease are now facing long-term consequences that could have been prevented. But because they can't afford the medications or the care, these diseases worsen. They often lead to irreversible damage or even death. Social media advocacy reports and news articles are filled with tales of people making heartbreaking decisions. More than 30% of Americans. We are talking about 34 million people. They say a friend or family recently passed away in the last 5 years after being unable to afford treatment for a condition. It's a heartbreaking but avoidable tragedy. Then, there's the financial nightmare. The weight of medical bills is crushing families. Parents who have always worked hard to provide are now forced into poverty. They lose their savings, their homes, and even their peace of mind just to try and save their loved ones. According to the CFPB, 100 million Americans owe $220 billion in medical debt. How much longer can we allow this to go on? The human toll is real, and it's time to take some real actions to protect our upcoming generation from this social evil. It's time to bring real change. Healthcare shouldn't feel like a privilege reserved for the lucky few, yet for so many, it does. Medicine is meant to heal, not force impossible choices like choosing between paying for prescriptions or paying rent. So, what's going wrong and how can we fix it? One major problem is how unclear drug pricing is. People have a right to know why they are being charged so much. When companies are upfront about pricing, it builds trust and let us hold them accountable. But transparency alone isn't enough. We also need strong policies. Government have the power to make real changes, like capping the price of essential medications to stop unfair markups. They also encourage affordable generics, giving people more choices without compromising quality. These are not minor fixes. They are steps towards a fair system that serves everyone, not just the wealthy. Pharmaceutical companies also have a responsibility. They need to realize that they are not making random products. They are creating life-saving solutions. That comes with an ethical duty to put people before profits. Sure, making money is part of business, but it shouldn't cost lives. Success should be measured not by profits, but by the number of lives saved. So what can you do? Well, change starts with you. You can demand transparency from companies and governments. You can support groups fighting for affordable healthcare. Most importantly, you can keep the conversation alive. Talk to your friends, family, and anyone who will listen. The more people know, the harder it becomes to ignore these issues. If health is a truly basic human right, why does it feel like out of reach for so many? It's a question we need to keep asking and act upon on. Why are life-saving medicine priced like luxury items? Why aren't governments doing more to cap prices and ensure access for everyone? What do you think? Let us know in the comments below. Till then, peace out.